So here we will be talking about some of the major anaerobic bacteria that are important in human diseases. So our anaerobes are going to be very prominent members of the normal microflora. So they are going to be and they are usually going to be non-pathogenic. So as long as they're in the right place and they don't find a way into our bodies, they are just going to be fine and they're not going to cause any problems with us. They are going to be common causes of abscesses and wound infections. And so this is when they are going to get entry into the tissues, and then this can lead to entry into the blood, and then you can get dissemination to other parts of the body. So they are really opportunistic anaerobes. And they often also are going to cause a disease or be isolated from a wound or a certain area of the body along with other bacterium. So they cause or associated with mixed infections. Now, there are some other anaerobes that are not normal flora, and so these are going to be more of your exogenous pathogens. So, our Clostridium, for example, Tetani, botulinum, perfringens are going to be exogenous pathogens. Now, Clostridium difficile can colonize the colon. Perfringens can also colonize the colon, but Tetani and botulinum are only in the soil. They don't colonize us at all. Now, the Tetani and botulinum can cause severe disease, and these can be fatal. We're going to talk again about exotoxins. As we know, exotoxins are going to be very powerful poisons that can be quite deadly, depending on their target, of course. So this is just a list of our common major anaerobes. We have our Bacteroides fragilis, which is going to be in the colon. We have Fusobacterium species. We have a lot that are associated with mouth and gingivitis, Prevotella bacteria. We have our gram-positive rods that are going to be Clostridium species, Actinomyces. We'll talk about Israeli. Propionobacterium acnes is going to be a gram-positive rod and is going to be the cause of infectious acne. Of course, not all acne is infectious. And then we do have a few cocci to highlight here. We have our gram-negative cocci, Villanona species, and our Peptostreptococcus positive, gram-positive cocci. Now, first up is Bacteroides fragilis, and this again is a normal flora in the colon as well as the vaginal tract. These are going to form short rods, so they look very stumpy. They're going to be, again, an endogenous bacterium, so they're going to be causing opportunistic infections. And so there are some predisposing factors for getting a Bacteroides. You're going to have ulcerations. It can infect if there's an ulcer. And you can have a trauma or surgery. Now, these guys are going to cause mixed infections for the most part, which is going to be the anaerobe Bacteroides fragilis and some sort of gram-negative facultative rod, usually. And these are going to cause local abscesses, And this is going to be usually an intra-abdominal or periodontitis type of infection. And then you can also have metastatic abscesses. And this is usually going to also be associated with spread through the blood. Now, these are going to be some of the most frequently isolated anaerobes from all the human infections are going to be our Bacteroides. Now, some of it is going to be a little bit obvious why that is. One of the things is that most of these guys are going to be antibiotic resistant. The other thing to keep in mind is they do have some virulence factors. They will have a capsule, and they also have, of course, LPS because they are gram negatives. They are going to because of their antibiotic resistant, the usual drug of choice for this particular infection is going to be the metronidazole. Oops. Sorry. With some sort of aminoglycoside. And then you can also use an alternative drug, which is cefoxitin. You also can have prophylaxis, and some of this might require surgery, abdominal and pelvic surgery, to get rid of the infection. Now, the next species in this group is Clostridium. Clostridium has over 70 actual bacterium within its species. The medically important Clostridiums are listed here: Tetanus, botulinum perfringens, and Clostridium difficile. Our Clostridiums are going to be anaerobic gram-positive spore-forming, so that's very critical. They form spores species. Tetani is going to have spores widely distributed in the soil, and actually most of them do. Botulinum also has widespread spores. The spores are going to be able to get into tissues via wounds or abrasions. And so inside the tissue, the spores are going to germinate, and then they're going to produce their exotoxins. And the exotoxins are very potent. So with respect to tetanus, tetanus has the tetanus toxin, also known as tetanus spasm toxin, which is a neurotoxin, and this is going to prevent the release of inhibitors of your spinal synapses. And so it blocks inhibitors, and so it's going to have spastic paralysis. And so the symptoms are basically going to be 3 to 7 days after the wound. And then you're going to get difficulty swallowing. Difficulty opening the mouth. So you have a lockjaw. You also are going to have trismus. And this is basically spasm. And you're going to have a generalized severe muscle spasms. And so this is going to lead to potential respiratory distress and failure. 60% of all cases require ventilation. So this is 60%. They're going to require the ventilator, relaxers, etc. So then treatment is going to be dependent upon whether or not a person has been vaccinated. So prevention obviously is going to be a vaccine, and it has to be boosted about every 10 years. If a person is exposed to tetanus, the treatment again will depend on the immune status of the individual. If the individual is immunized, you then will clean the wound, you will treat the bacterial infection with a penicillin, and then you will give the individual a booster shot if their last booster was more than 5 years ago or before the incident. If you have an unimmunized individual or somebody who doesn't know whether or not they have been immunized within the last 10 years, you then would again clean the wound, give penicillin, and you would give them tetanus toxin immune globulin. In addition, most patients are going to require some sort of muscle relaxants, ventilation, and respiratory support as well. Now, in the United States, we have about 10 to 40 cases per year. Worldwide, they have about 15,000 cases per year now. There's been a lot of progression with respect to the distribution of the vaccine and preventing infections, because back in the 70s, there was about 300,000 cases a year worldwide. It still is considerable cause of death in infants. So neonatal tetanus has about 5,000 cases a year, and it's still considered a significant cause of neonatal death. Now next is our Clostridium botulinum. Again, this is going to be our spores in the soil. Botulinum makes botulinum toxin. It is a neurotoxin, similar to our tetanus toxin. However, it blocks the release of acetylcholine, and so this is going to be a flaccid paralysis. So tetanus, you overactivate your nerves, and botulinum are underactivated. There are different types of infections associated with Clostridium botulinum. There's a foodborne infection, wound. We also have infant, and then we'll talk about treatments. So foodborne is going to be ingestion of the exotoxin pre-made. Wound is actually going to be production of the exotoxin when you introduce the bacterium into an actual wound in the body. Infants are going to eat something that has the spores. The spores will germinate in the stomach of the infant. You'll get a transient production of the toxin in the GI tract. And then some people have injections of pharmacy-grade botulinum toxin, Botox, and that is going to potentially cause disease in those people. All right, so foodborne intoxication or poisoning is when you have ingestion of the toxin. So in general, botulinum toxin is everywhere in the environment, and it can get on both meats and vegetables. It has also been associated with improper treatments of food, such as inadequate canning of food products or inadequate food storage of products. And then the spores are going to germinate in each of those conditions, and they're going to make the toxin. So when you eat the food, the toxin is pre-made. Now the symptoms for food intoxication is about 1 to 4 days after ingestion. You're going to get double vision, a difficulty to swallow, flaccid paralysis, and then you eventually will have cardiac and respiratory failure. Now, in order to prevent food poisoning for botulinum, you want to do proper canning, heat layable toxins. So if you just heat things up to 100 degrees for 20 minutes, boil things for 20 minutes. That's why when you're canning something, after you prepare it, you put them in water, and you make sure those jars are fully submerged in water and they're boiled for 20 minutes. The treatments are going to be an antitoxin, and there are different types of your toxins. The most common for humans are A, B, and E. So it's a trivalent antitoxin because there's not really time to figure out which one a person is infected with. You need to treat people very quickly. You have to have respiratory support, make sure that they can breathe. There's also going to be, of course, cleaning of the wound if there is an actual wound, and penicillin. If it's untreated, there's about a 65% mortality rate. Even in a treated, there still is a relatively high mortality rate, about 25%. Now, infant botulinum is also important. So infant botulinum is where you have ingestion of spores by an infant, and it's usually associated with unpasteurized foods such as honey. That's why people are told not to give their newborns honey. The spores will germinate in the gut and then produce the exotoxin. Of course, it'll be transient, but it can do a lot of damage to infants. There's also wound botulinum, in which your spores are going to be in contact with some sort of cut or wound, and then they will germinate in the wound and produce the exotoxin. Now, infant botulism is going to be the most common form of botulism in the United States. So this is the most common. And it's going to account for about 70% of all Clostridium botulinum cases. And the cases are going to be sporadic. And honey is really the only known risk factor, although there are some cases that have some unknown, that do not have a known honey exposure for the infant. And then wound botulism occurs almost exclusively among injection IV drug users. Oops. And so there's black tar heroin, for example, is high incidence of botulism. So this is about 96% of all cases. And then there have been some cases also associated with unlicensed Botox. Make sure if you do that, or if someone you know is doing that, make sure they do use a pharmacy grade and go to a licensed facility. Now, our Clostridium perfringens is also going to be present in the soil. It can be normal flora, and this can be in our colon or vaginal tract. Now, this is going to be associated with food intoxication and poisoning. The spores are going to survive cooking. They're going to germinate in leftover foods, and then you ingest the spores, and then they're going to germinate in the gut and produce an enterotoxin. The symptoms of this is going to be about 8 to 16 hours. You're going to get watery diarrhea and cramps, and then this typically will resolve on its own. So it's just supportive care. Now, the one that it's most famously known for is, of course, gas gangrene, which is an active infection. And so you have some predisposed conditions in which you need to have some sort of trauma. So this would be a deep wound, such as during an auto accident and even during abortions. The bacteria are going to grow at the site of the injury, and they're going to produce an exotoxin. And this exotoxin is alpha toxin in the bacteria, which damages the cell membranes. It's a lethacinase, and it damages cell membranes. Basically, your Clostridium is an anaerobe. It doesn't want air, and so it's going to kill cells around it. so that it can create a nice anaerobic environment for which it will continue to grow. The symptoms are going to be pain, edema, gas. You're going to have hemolysis, jaundice, septic shock, and death. It's very aggressive, of course. And then our last guy we're going to talk about is our Actinomyces. The most important form or variant of this is Israeli. Actinomyces is going to be a gram-positive branching filamentous rod. It does not form spores like our others that we just talked about. It is part of the normal microflora in the mouth, the GI, and vaginal tissue. The disease is called actinomycosis, which is going to be lumpy jaw. It's very rare in the United States, and it's going to be a normal flora bacterium in the bovine mouth, as well as others such as goats and sheep as well. So a predisposing condition for this is going to be, again, a local trauma. Oops. And then the bacteria invade the tissue and produce abscesses. And then usually this is going to be a mixed infection. And you're going to have your Israeli and a facultative bacteria, for example. Now the symptoms are going to be a slow developing hard lump that becomes full of pus, and it becomes a draining abscess. And then this is going to be a mass of gram-positive branching filaments termed sulfur granules. And the treatment is going to be a long-term penicillin with surgical drainage.